People in the City of Port Colborne are face to face with Ontario's healthcare crisis tonight. The urgent care center at their local hospital has closed for the night because of a doctor shortage. It's leaving local residents wondering where to turn in an emergency, and the provincial government facing calls to fix the problems in healthcare. Sweeney was in Port Colborne today and has the latest.
Outside the Port Colborne Hospital this afternoon, people were worried about what happens in an emergency.
If somebody's drastically hurt and they need to come to the hospital, there's no doctors, it's a very bad thing.
It doesn't make sense that that an individual in need, and it could be seconds, minutes, not hours of wait, need to be attended to quickly.
But until tomorrow morning, anyone in Port Colborne who needs urgent hospital care will have to go somewhere else. Niagara Health announced this week that the hospital's urgent care center was closing from 4 p.m. Saturday until 8 a.m. Sunday, 16 hours. Niagara Health says it was a last resort, but despite exhaustive efforts, they were unable to fill one physician shift. It calls this a unique situation due to staffing pressures. Niagara Health suggests people with serious medical issues go to an emergency department at another hospital. People with other health concerns should visit their primary care provider or a walk-in clinic, call Health Connect Ontario at 811, or go to the Fort Erie Urgent Care Center, which is about 30 minutes away. A recent count indicates that since the end of June, 18 hospitals across Ontario have had to close their emergency rooms at some point, sometimes more than once. The closures lasted sometimes hours, sometimes overnight, in one case 3 weeks. And the South Bruce Grey Health Centre has announced that the emergency room in Chesley near Walkerton will be closed for 2 months until December.
Families are going to be put in danger, and their lives are going to be in jeopardy if they need those emergency services and they're not there. The whole community is very, very concerned about this.
The NDP MPP for the Port Colborne area says the problem is not just about doctors, but about healthcare workers who he says have been treated badly since COVID arrived, and on top of that need a raise.
This is a problem that was avoidable, and the government is just not implementing the solutions they need to address the staffing shortages.
The Ontario Nurses Association agrees that it's not just doctors but nurses who need better treatment, but says the government isn't listening.
People are going to die. And I know that sounds a bit dramatic to say, but it's the honest to goodness truth. I used to say we are like the Titanic and we were sinking. We've actually sunk right now. We're at the bottom and we cannot lose another nurse.